I'm Robert Smith. I'm the Senior Vice President for Cancer Screening, and I lead the American Cancer Society's Center for Cancer Screening and Early Detection Research.
And introduce your research, please.
The research that we've been doing is with a very large database from Sweden of mammography screening. It covers many decades. The Swedish uh, uh, public health system has got very, very strong, detailed records, and it allows us to measure the benefit of mammography screening and answer a lot of questions about mammography screening in ways that are very difficult to do in the United States.
And why is this relevant to the public?
Well, we decided to look at what was the benefit of consecutive mammography screening. I mean, it sort of stands to reason. It should be obvious, right? We tell women, get your mammogram, right? But we don't put a whole lot of emphasis on the importance of regular screening and getting your mammograms on time. And many women will get an invitation to come to screening, a reminder that it's been a year since their last mammogram, or 2 years in the case of getting biannual screening. And it may be that something's come up and they can't keep their appointment. And a good bit of time may go by. In fact, they may never catch that appointment and just go to their next one, but they might miss the next one as well. So we were wondering, well, what is the advantage of continuity in screening? What is the disadvantage if you happen to have breast cancer and you would not know it because you don't have symptoms, if you miss that examination and don't attend until the next year, or don't attend until maybe a year or two later, which happens.
Any final remarks or closing statement?
Well, yes, the important thing is that I think it's easy to treat this rather casually because you feel fine. You don't have symptoms. You're due for regular mammography. You can't make your appointment. And when you call to reschedule, the next one is 4 or 5 months into the future. But we found, looking at just missing 1 or 2, that there could be up to a 25 to 30% greater risk of dying from breast cancer if you had breast cancer but missed that examination. And so eventually your breast cancer shows up symptomatically. For women who attended 5 consecutive mammography screening examinations compared to women who attended none, there was a 72% greater risk of surviving breast cancer compared to the women who did not attend. And that meant, in effect, you had this incremental benefit from dutifully attending your regular mammogram appointment, because you don't know when you might be diagnosed with breast cancer. And I think the critical point here is that we need to remind women that it's important, no matter how well you feel, it's important to attend regular screening because you may have breast cancer and you don't know it. And early detection offers you the greatest opportunity to avoid a diagnosis of advanced breast cancer and to reduce your risk of dying from breast cancer. That message has not, I think, been made clear enough. And I think it's also an important message to the imaging facilities to do whatever they can to get this patient back into the schedule as quickly as possible and not let months and months go by until she can schedule her next mammogram.